show you dry needling. I'm going to do her upper traps and right at kind of the base of her neck here. And so, like we talked about before, the goal of dry needling is to kind of loosen that muscle up, release those trigger points so that she can move a little better, maybe have a little less pain. So like I said, I use a very thin needle. And so we'll start here on her left trap and just grab the muscle here. You know, we maybe find out, okay, we feel a little trigger point there, so that's where we want to go. And as we get the needle in the area that we want, there's a couple different techniques that we might use. Sometimes I will just place the needle and I can kind of leave it and use a little stim machine to make that muscle jump, which I'll show you here in just a second. In the upper traps, when the person does well with it, I like to kind of release multiple trigger points if I can, and so end up just kind of moving that needle around just a little bit and find those trigger points, and you'll feel it kind of twitch and release. And so that's kind of the goal there. So, you know, say I have a good spot in the trap there, what I'll do is I'll move over to her other side. Maybe she has another little trigger point here on this side, and so go on the right, same kind of thing. I kind of find out where that maybe tender spot is, or where that trigger point might be, and I just kind of go after it. And so for this one, what we'll do is we'll just kind of find our spot there. We'll just let it hang out. So again, once the needles are in, for the most part, you might know that they're there, but they typically aren't, there isn't too much discomfort associated with them just kind of sitting there. You know, when you release the trigger point, it can feel like a little bit of a mini Charlie horse. It kind of hits and goes away, and so you know there's a little bit of soreness from that, but typically not too bad. And so what we'll do is, you know, we've kind of hit those two muscles that we tend to kind of be really guarded with a lot of times. So we'll kind of move in and kind of get right at the junction, right at the base of her neck there where it goes into the mid-back. And so again, here we're just kind of finding the area we want to go. We kind of find that little bone there. We're going to go on either side of it. I've kind of kept it close, you know, they can go a little deeper or just stay a little bit more superficial. So from this point, you know, if I need to, I can adjust them. You know, you kind of have them in the spot, you know, or that you're in a safe spot there. So if you need to adjust or move, you can do that. Do it okay?
Yeah, good.
All right. And so typically once I have those in place, I might use some form of stem. I have two different kinds, and so I'll show those to you. So if you've ever had like an e-stim machine when you've been in therapy or other thing, this is kind of like that. It just sends a little bit of a electrical current. It's going to make those muscles jump and twitch just a little bit. It should be comfortable, shouldn't be sharp or any discomfort associated with it. And so we kind of start low and we'll kind of find, you know, two different needles, and it's kind of a point to point. And we'll say, okay, you feeling anything there? I'm jumping, okay. So I start out really low and I kind of build up. Any thumping or anything there? Okay, go up a little more.
Oh, yes.
Yeah. So now we got the muscles jumping a little bit more. You okay there?
Yeah.
And so we kind of do the same thing through here, where you just stim it, get those muscles to kind of move. These are a little bit smaller muscles that are along the spine. These are bigger muscles, you know, our posture muscles, and so this is one way to do it. Also have another unit. So this unit's a little bit different. So this has what is called gator clips. So these will actually clip onto the needle. So I do this in, you know, times where I want to maybe leave this on for a little bit longer, and so I find you know, clip onto the needles here. And then from here, it's kind of similar. I just kind of slowly turn up until she can kind of feel it. And so just let me know when you start to feel a little bump. It's okay there? Okay, not too strong?
No.
All right, so now we know, you can see those muscles kind of moving, jumping a little bit, helping to loosen them up a little more. So we got those. Now we'll move up into the other two. So just kind of let me know if you start to feel the other two.
Yes.
So once we get it comfortable there, so again, this might be one that I'll say, okay, hey, we're gonna let this hang out for maybe 5, 10, 15 minutes, kind of depending on what's going on. And we just let those muscles contract and release and just kind of loosen up. and then we'll come back, and after that usually we'll do some heat or something like that to help those muscles relax. But basically that's dry needling. I can use this just about anywhere in the body, any muscle. We go down to the legs. I do this all throughout the spine. So it's got a lot of good uses, something I use throughout the day, every day. And so I find it to be a very effective tool.